Now, while South Africa continues its tests on the first batch of vaccines it has received, many employers are wondering whether it is legally permissible for them to require their employees to be vaccinated. For more on this, I'm joined by Professor Simon Nemutandani. He's the chair of the Health Professions Council of South Africa. Very good afternoon to you, Prof. Perhaps let's take a look at the standpoint as far as healthcare workers are concerned. Do workers have the option to opt out of the vaccination, or is it compulsory for healthcare workers?
Good afternoon. One would say the Health Professional Council is encouraging all health professionals to take the vaccine. However, we are not in a position to say to those who are not willing to take it, to say we should force them. So we are saying for now, it is in the best interest of all health professionals to take the vaccine, and also to make sure that they protect their patient, their family members, wherever they are. But as we are all aware, one cannot force anyone to take any medication. But in the interest of saving lives, one would encourage all health professionals to take the vaccine. The position of the Health Professional Council is that all health professionals should be encouraged to take this vaccine. That's the position of the Health Professional Council.
You say that you would advise healthcare workers to take the vaccine. If they decide not to take it, I mean, we have actually spoken to quite a few healthcare workers who say they're still uncertain, that there's still not enough information out there for them to be comfortable enough to take the vaccine. Should they decide not to take the vaccine for whatever reason, what would be the repercussions of their refusal?
Well, it will be taken as if they're exercising their right to take any medication. And if they do not want to take any medication for any reason, it will be important for us to engage them to understand what are the possible reasons. As we are all aware, there have been a lot of media and WhatsApp messages and going around to say this will not be good. But however, what we need to focus on is convincing them based on science that for now the best way to protect ourselves so that we get the vaccine when we are still alive, because the vaccine will be not effective when you give it to the dead people. So vaccine for now, in terms of WHO and CDC or Center for Disease Control, they are saying vaccine is the best available resources that should be applied to stop the pandemic. And that is the position. But however, one cannot be forced. Now, your question to say what will be the consequences of refusing to take the vaccine, it will depend, but on the basis of protecting themselves and protecting their family members and their patients. The Health Professional Council is encouraging all health professionals to take the medication.
Now,
we
Doctor,
should understand that,
Doctor, a little bit earlier on, I spoke to a senior legal advisor from Strategy Labour Solutions, and we're talking about the responsibility of the employer when it comes to adhering to the Disaster Management Act and making sure that all employees actually do subscribe to the act, that they wear their masks, that they sanitize, that if they tested and are found to be positive, that they, self-isolate and quarantine, etc. But he also spoke about the fact that if there is an agreement that is put in place between an employer and an employee in the labour agreement, that there are some employees who could stop their workers from coming into work because they have perhaps refused to take the vaccination or cannot actually produce a vaccination certificate. What is the standpoint of the Medical Health Practitioners Council regarding this. Is this a route that you yourselves would consider taking, making it mandatory for workers to actually have a vaccination certificate before they can actively go back into the workspace on the front line?
No, the Health Professional Council has not taken a position to enforce their health workers to take the vaccine. We are a regulatory body that is responsible to regulate the profession and also to make sure that we protect the community. We regulate the profession by providing the guidelines with regard to the best practice that is available. And for now, the best practice that we are encouraging and also making sure that all our workers or our staff and our healthcare professionals adhere to is that the vaccine is the best method available now. Now, with regard to the legislation that is enforcing healthcare providers to take the vaccine, we have not taken that position, and I think it will have to be tested in the court of law whether one can force a person to take a vaccine against their own will, and depending on the circumstances. For now, as we are hearing, it's an issue of not being sure and also questioning the process of the vaccine that is taken. And we should also take into consideration that almost all South Africans have taken vaccination one way or another when they were still young for different diseases, diphtheria, tetanus, and whatever. That has been taken. But with regard to this condition, I think the doubt came in when there were a process that would not have been followed and the period of taking trials when you are doing the vaccination. And that is where the problem stemmed from. But we believe that with the engagement and with convincing and government doing the right thing and also the professionals guiding each other, we'll be able to get out of this situation. But for now, the Health Professional Council cannot force anyone to take the vaccine.
Because really, according to the Constitution as it stands right now, that would be in direct contravention to the right to bodily integrity if it does actually go that direction of enforcement. But there are some health workers as well who are saying that they haven't been trained on how to even administer the vaccines. What is the plan that's going to be put in place as far as making sure that healthcare workers themselves are comfortable with administering the vaccine when the time comes?
Our understanding is that all provincial health departments have embarked on a process of identifying the sites where the vaccination will be taking place. They have embarked on a process of training those that will be vaccinating others. And the plan was that as from tomorrow or Wednesday, the vaccination will be taking place. Now, it may be that those who are in the private sector are lagging behind, that they may not have been engaged. But as we are all aware, this process is being handled by Department of Health. As a council, we are saying all health professionals should be trained and should be guided and have all the information as to where they can be vaccinated. Those who are trained should be available to vaccinate. And I think the focus is more about training the nurses and the doctors so that they can go around. And we all know that this is a very sensitive stage. And it's also, we are in a situation where it's a very guided vaccine so that it should not get on the wrong hands and it disappears. So there is a control that we are told government is embarking on it. And there have been plans to train. If health professionals in the public sector have not been trained, I think that process will come to them very soon.
Before I let you go, Professor, what is your standpoint as the Health Professional Councils of South Africa on the administration of ivermectin for the treatment of COVID-19?
As you are aware, that has been the court case that AfriForum has taken the Department of Health and CIPRA. And the case, in our understanding, is that there has been a ruling that it should be made available. We should all understand that there has been a challenge because this drug, it's used in the animal along the veterinary science. But now that there has been a process that the court has given an undertaking with regard to it, we will support once it has followed the regulatory process in South Africa. Number one, it must be registered to be administered among human beings, because for now it has been used among the animals. And the process that should be imported into the country, it must be controlled. We wouldn't want anyone to just be dispensing it. We would want it to be controlled under the regulatory measures that are there in South Africa, that any product that enters South Africa, it should be regulated. We should know who is dispensing it. We should know under what circumstances is it dispensed. And if there are adverse effects, those that are dispensing it should be able to report it immediately so that necessary intervention should be taken. So as a council, we are at a position where we are saying the regulatory measures, or CIPRA in South Africa, is the one that should really manage this situation.
All right, Professor, thank you so much for your insight as well as your views this afternoon. That's Professor Simon Nemutandani. He's the chair of the Health Professionals Council of South Africa.